Hello, everyone, and welcome to the AsianDHD podcast. On today's episode, we are talking about ADHD in the workplace. So, my name is Faz, and I am the host of this podcast. And today's episode, my guest is Sam, and I'll let him introduce himself to you.
Hi everyone, so my name is Sam. I'm a strategy leader at the NHS, strategically for the last approximately 10 years. Got a massive fascination with ADHD, especially as we see there's a massive increase in the number of our workforce that have got ADHD. Today it's a pleasure to be able to join Fazli to kind of learn from him to see how we can impact the future and how we can impact workforce as well.
Thank you for that introduction, Sam. We're very happy to have you on board. We've been planning this for a long time, and we finally managed to sit down and have a conversation about it. Sam doesn't have ADHD. He's neurotypical, whereas I have ADHD. I was diagnosed this year at the age of 36, and basically my entire life suddenly made sense in terms of experiencing depression, anxiety, unable to focus, being told things like, you have so much potential, but you're just wasting it. The whole theme of this podcast is ADHD in the Muslim space and the Asian community and other ethnic minority communities, and how it impacts people in terms of shame, stigma, not just in the workforce, but in society and in just day-to-day life. Because ADHD, you may or may not know, is a neurodevelopmental disorder. So it's 50%, and I have to fact check this, but 50% hereditary and 50% environmental. So a lot of people, especially I think of my generation and previous generation, have gone either undiagnosed or get a diagnosis later on in life when they've been through their struggles. So we'll start off the conversation by understanding the symptoms and how it manifests in adults, and then we'll give some statistics and perhaps misconceptions. So Sam, feel free to jump in.
That'll be good to know, because from my end, it's how do you know when you've got it? How do you know when to check for it?
Mm-hmm.
I just don't understand what it is. So if somebody does have the symptoms, but they're not, and they don't have ADHD, I think that's one of the clear issues that we've got at work at the moment. And I'll go into it once we start talking about the symptoms anyway.
Mm-hmm. So this is the website that I use, ADHD 360. So I got diagnosed by these guys. And if you go into ADHD in adults, right, the symptoms, there's 3 types of ADHD, right? You've got predominantly inattentive, predominantly hyperactive, and or impulsive combined presentation. So the difference is predominantly inattentive presentation. This form is characterized mainly by difficulties in sustaining attention, following through on tasks, and organizing activities. People with this type of ADHD are often forgetful, easily distracted, and may overlook details. Then the second one is predominantly hyperactive, impulsive presentation. This type features symptoms like fidgeting and an inability to stay seated, incessant talking, and a tendency to act without thinking. This emphasis is more on hyperactivity and impulsivity rather than inattention. And the final one is a combination of both, combined presentation. As the name implies, this form of ADHD involves a combination of symptoms from both of the above types. People with combined presentation ADHD exhibit both inattentive and hyperactive impulsive behaviors, like myself. So I don't fit into the first one or the second one, but I can see myself definitely as a combined presentation. So each of these present the individual with different challenges. Well, how does ADHD manifest and affect people's lives? That's the kind of the overview of ADHD in adults. People with ADHD struggle with focusing on tasks, frequently shifting between them, difficulty with organizing and prioritizing tasks, missing deadlines, and forgetting work responsibilities. And I'll give you an example of this. So for me, when it came to school assignments, I would procrastinate so long that I would keep it just the day before the deadline and I'd start. And what that would mean is either I would do really well because I'd be hyper-focused, or I'd completely fail. So it's always one or the other. Behavioral symptoms: restlessness and difficulty staying still for long periods, impulsive decision-making often leading to poor judgment, difficulty in sustaining conversations and social relationships. Personal life impact: challenges in maintaining a stable emotional state, difficulty in sustaining long-term relationships, frequent mood swings, and emotional outbursts. So for adults, untreated ADHD can result in various issues from career setbacks to challenges in personal relationships. It's crucial to identify the symptoms and seek diagnosis and treatment. as appropriate, interventions can lead to significant improvements in quality of life. So that's basically a summary of ADHD.
No, I was just going to ask you something. So if you don't mind, right, I'm going to play devil's advocate. Reading all of those, I listened to all of the symptoms that you give. It's definitely really helpful to kind of hear what it could be. But sometimes I think some of these points can be quite generic. Now, from a workplace perspective, I'm a true believer in an interdependent workforce. There's no, I think the manager is as important as the person that they're managing. One of the things that I see is if we were to look at the symptoms and you were talking about, for example, when it comes to inattention, what if that person now, they haven't told you they've got ADHD. You don't know they've got ADHD. They don't know they've got ADHD. And you have someone that just struggles to organize tasks. So, for example, somebody's a little bit lazy. They have difficulty in sustaining attention in conversations. Maybe they just don't care about the subject as much. They avoid or they're reluctant to engage in tasks because they've got a substantial contract. They don't really want to get involved. They don't want to kind of think outside the box. Frequently lose items necessary for tasks and activities. They're just careless. And they're easily distracted by external stimuli. So we've seen multiple people that if there's another better job elsewhere, they get up and go. Now, if you've got a person like that follows similar symptoms, but they don't have ADHD, how do you now approach a situation like that?
So you're saying they don't have ADHD, or you don't know? Or
we don't know. We don't know. They don't know. So they've never checked themselves. We never checked. We've never, to be honest, within the workforce, you don't have a right to go and tell someone who might be having these symptoms. And sometimes it's symptoms, sometimes it's more like actions, right? So when do I realize that they're struggling with organizing tasks? I might not see it as a struggle. I might just see it as an inability or not wanting to. Now, if I was in the workplace and I saw a member of staff that wasn't really engaged, I wouldn't be able to go up to them and say, you need to now go diagnose yourself.
Of course not.
So how do you now manage something like that?
Well, that's a question for you then, isn't it? Because I'm not in a leadership position to kind of tell you, because that's the thing is, how does one know they have ADHD? They won't, because unless they become aware or they've gone to therapy like I did, and then my therapist, after I think 6 months of sessions, finally said, look, I think you have ADHD. And then he recommended a book. And that book was Scattered Minds by Gabor Mate. When I read that book, everything in my life made sense. So the thing is, no one knows they have ADHD. No one will know unless they've been diagnosed or they've been told by a mental health professional, most likely a psychiatrist or someone who is experienced in dealing with ADHD. But what you can do is perhaps have some resources on your work website. Or, for example, October is ADHD Awareness Month, right? You could probably circulate an email, infographic, and share that around, and then get people to start talking. The thing is, I think most workplaces I don't think they probably have someone that deals with mental health, like a counselor, or the thing is, a counselor would not be able to also tell unless qualified in attention deficit disorder.
You know, in our workplace, right, we've got loads of ways to kind of get people access to these situations. So if they want to get a counselor, they can. We've got employee assistance programs. You've got access to psychologists. So within the NHS, you've got multitudes of ways of getting support when you need it. I think one of the bits kind of hearing from what you're saying, which is really helpful, is how do we kind of get people to start to reflect a little bit more? When I look at this now, an old school manager, and we've all been with these old school managers, they'll look at this and they'll look at your list and it'll be either you have ADHD or bad behavior. It's one or the other, right? So if you're not kind of keeping to your contract, you're not paying attention, you're not kind of thinking outside the box, you're not organized, we'll deem that as bad behavior. So now it seems that there might be a bit of a thin line. And how do you now kind of make that distinction pre or post diagnosis? So if you were to be in the workplace, now you know you got ADHD, what would be the first thing that you do to make sure that your team and the people around you are aware of this?
Before the application, I'd let the HR team know. If I was to get the job, I would then go to my management and tell them about it, right? Because if they're aware of it, then they can set up measures in place to help me perform at my best, right? Because simple things like having a noise cancelling headphone or a quiet space, little adjustments, it doesn't have to be big because not every workplace can do that, right? But little things like that can help someone that has ADHD.
I think so. From our side, we do have a colleague that has ADHD within the team. She's incredibly intelligent. Problem is, she's not the right fit for the team. Now, she's the right fit for individuals, but not as a team. And this is one of the things that we're kind of struggling with at the moment, is whose responsibility is it to care? Now, from a line manager's perspective, of course, I've got a duty of care, and I need to make sure I provide the right reasonable adjustments for them to be able to perform at their best. But that isn't for their peers to do exactly the same. Now, this duty of care is something that is becoming a bit of an issue in the workplace, especially when you've got growing or expanding teams, is how do you now get that same level of care or that same level of kind of attention to this individual? And you can't mandate that because a lot of these things and a lot of the behaviors are quite subjective as well. So this is one of the bits that we're kind of dealing with at the moment, which we really used to kind of, from your perspective, if I was to put you in that situation to see what we can do to kind of make that work.
The thing is, people with ADHD are incredibly smart and creative, and they usually have a highly specialized skill set. They're either good at analysis, some form of analysis, or they're very creative. To deal with ADHD, like I said, the main thing is engaging in clear communication with managers and colleagues. If someone doesn't know you have these challenges, then how can they, help?
I want to kind of come up with a scenario based on what science sees. So you've got physical symptoms, emotional and cognitive. So the interrupting others, fatigue, fidgeting. So like you said, my colleague, she's got ADHD, incredibly intelligent. Her intelligence is above others. I don't think her emotional intelligence is as high as others, but this is one of the things she does do. She will interrupt people when she knows the answer to a question. She gets tired quite easily. So when she's had that interaction and feels exhausted by the afternoon, she fidgets quite a lot. That makes people think that she's just about to pounce to interrupt, but she's not actually interrupting. She's just fidgeting. Then the emotional side, so low frustration tolerance. So she used to get, not just was she interrupting, she was interrupting with a level of force. So this gave this sense of superiority when she was speaking over people. So every time we tried to kind of get the peers to say, well, look, she does have ADHD and we need to manage this behavior then started to take its toll on the rest of the team, who would come forward with an idea and she will shut them down. And now this is not no fault of hers. It's because she does have a better idea. It's her delivery of that better idea wasn't the best. And the cognitive element, the difficulty in concentrating, racing through and anxiety, she was racing through thoughts. But the amazing part about her was all the thoughts that she had were the correct thoughts. So very strategic, very forward thinking, and incredibly innovative. And she would put herself in a cycle of anxiety. So this individual here, she was incredibly intelligent, great ideas. She was able to deliver. But the impact that had on the wider team was very negative in the sense that the team could not gel. Now, how do we now work in an environment like this? And again, whose responsibility is it?
So the problem with people that have ADHD is basically we're very blunt. Because we interrupt people or we can't basically stop ourselves from thinking all the time. It's like sometimes we blurt out stuff, right? And I'm sure you've noticed this in myself when I'm talking to you. I'd sometimes change topics or I'd blurt something out, change the topic. It's because my brain is going so fast. All of this is manageable with treatment, with medication, therapy. Now, obviously, I don't know her circumstance because her circumstance is her own, right? I can only talk from my experience, right? But what was your question? See, I keep forgetting things when I'm having to focus on too many things.
No, that's no problem. So whose responsibility is it within a growing team to support an individual with ADHD? Is it the duty of the person with ADHD to make tweaks where possible? Or is it the duty of the rest of the team to change the way they do impact their own mental health and their well-being in the process of it?
So it is definitely, her responsibility as well, because if she knows she has ADHD and she knows kind of what her behaviors are, and well, it depends on if she's getting professional help and if she's taking medication to control her symptoms, then it's obviously her responsibility. It's also the responsibility of the management team and her colleagues to help her or a bit more gentle, because the problem with people who have neurodivergence is a lot of these people face not only stigma in society, but they're constantly ostracized for being a way that they didn't choose. It's not like we chose to be this way. It was just the fact that we were born this way. So it's a tough one. I don't know how to balance it. And I guess that is your challenge, to figure out how do you manage people with ADHD.
So what I've done so far, right? And stop me if I'm wrong. So
about strategies, right? You've implemented.
Strategies I've implemented. First thing that I realized straight away was, and she requested herself, was she needed to see the bigger picture. She needs to see the end goal. She felt anxiety when she didn't know where her work was leading to. So we did a really big mapping exercise and we started to align the a mapping exercise with the work and the priorities of the team. So she knows where she fits in. And I think that was one of the difficulties that she had, was she didn't know where she fit. And with our area of work, especially when it comes to strategy and the National Health Service, is that it changes overnight. There's so many external influences that impact it. So we needed to find a way that she fit and she had clarity in the work that she done. Two, when it came with the team is still struggling with the team, I'll be honest. I think that is not an imbalance of her ADHD versus them, but an imbalance of insecurities as a whole. The workplace now, I think everyone can see, is incredibly competitive, and the competition in the market, as well as the reduction in how long people stay within a single role, has led to that increase in competition in the workplace, which means you don't have time to allow yourself to help someone, because the person you're helping is going to be competition, if you see what I mean. So what we're starting to do now is provide her with work where she has full autonomy. And I realized she needed more autonomy than others. But what we would do is bring in support where required. So I was kind of her mentor. We will support each other through work together. We'll give her time. I've had to free up my calendar to make sure that my flexible working hours match with hers to a certain degree, that I'm available when she needs me. I feel as though that's something I need to do. And I think we all need to do it. I think as leaders, as managers, as colleagues, we need to do that because we're all in it together.
Mm-hmm.
I can't do my work without her. And without her excellence and without her intellect, I wouldn't be able to deliver anyway. Mm-hmm. So it doesn't make sense me not to make some adjustments to the way I work, because I am a beneficiary of her skill set, or I wouldn't have recruited her in the first place. Mm-hmm. And likewise with my colleagues, there's a bit around benefit realization of somebody with ADHD. And I think we need to start celebrating ADHD more than just treating it. Mm-hmm. Because like you said, with ADHD comes intellect, it comes innovation, quick ideas, very, very fast solutions. When they understand the problem, I've seen that she comes up with a solution faster than any of us.
Yeah.
People that have been in the system for 30 to 40 years, yeah, she'll come up with a solution faster. So I think there's an element of embracing and celebrating ADHD, not just seeing it in a sense of, well, how do I now treat it? How do I change things? What do I need to do? Because I'm the beneficiary of her ADHD.
And you know what? That's so refreshing to hear, because going to like our next point is building supportive relationships. It's so important. So for me, obviously, when I found out, one of the first people I told is you. And you being you, obviously, you're very understanding. And obviously, I've talked to you on this matter extensively. But not everyone has that level of understanding because of, look, I've spoken to people that have said, look, ADHD isn't even real. Or, some have even said, apparently, most of the population has some form of ADHD or a mental health disorder, which is not true. I mean, they could have a mental health disorder, whether it's depression, anxiety, so and so, because mental health disorders are so common now. I mean, 1 in 4 people in their lifetime will experience a mental health challenge, right? But ADHD, the whole thing about ADHD is because of shame and stigma, people tend to isolate themselves. People tend to mask their symptoms, right? But what essentially masking is they become kind of like chameleons to fit into society or workplace when that's not their true selves. And when you start doing that, you're not being authentic and genuine, but you're not being true to yourself. And then what happens is you try and fit in and start to people please, or do you go the opposite route, which is you start being aggressive and angry, and people start looking down on you and start to kind of resent you and hate you even more, which then amplifies the problem. But when you have people like yourself that are very understanding, it makes things a lot easier for people with ADHD, autism, whatever it may be, right? I can't speak of autism. I don't have autism. But definitely about ADHD is you can make arrangements, like it can be little things, like just talking to them, pointing them in the right direction of a mental health professional, making flexible work arrangements. Like I said, even training and awareness, highlighting the importance of training and hosting maybe an awareness day for mental health, not just depression, anxiety, bipolar, whatever, but other things like neurodivergence, AD, and all of those things. Because the only way we can get rid of stigma, shame is to eliminate ignorance. And how can we do that is to educate ourselves and other people and have a conversation. And that's what we are doing here. Because when we have conversations, we can ask questions. And when we ask questions, we can then kind of analyze what we've said to each other and make some key points. And by having those conversations, we can then basically build like a framework, perhaps.
See, one of the things I was going to say, though, so when I was looking at your slide around building supportive relationships, we see that a solution to kind of people with ADHD and issues like that is a supportive friend partnership, being there for each other, offering encouragement, and providing emotional support. It's crazy that that's like the kind of the post to when somebody has ADHD. That would just be the kind of the cultural norm. Yeah. And it's amazing that we've come so far in this world, right? So come like me and you, we've known each other for exactly bang on 20 years now. And we're talking about now about how important friendship is. So we've been friends for 20 years, right? And we're looking at it thinking, how would the world be seen through somebody's eyes if everybody just had the basic innate human characteristics of just being kind and open? This shouldn't be something that is an offer for people. I shouldn't be offering my kindness. My kindness just should be who I am as a human. And I just find it fascinating that sometimes we need to ask for kindness. We need to ask for forgiveness in a time where humans should be just giving it anyway, especially with everything we see around the world right now. Being forgiving, being kind should be the easiest thing.
Yeah, no, absolutely. Like, that's the thing. That boils down to kind of empathy and emotional intelligence. Now, the thing with people with ADHD is people with ADHD tend to be very caring and supportive of others, but they tend to be very self-critical, perfectionist, and basically they tend to put themselves down. So just having someone, whether that's a friend, a colleague, a partner that acknowledges their neurodivergence and their way of thinking, because it helps. A person with ADHD has, like you said, your colleague is capable of has a really good problem-solving mind. She comes up with solutions really quick. So we should, rather than look at the negatives, we should start encouraging them to build on their skills rather than just putting them down for what they're not doing. Maybe someone else can take on that burden. Like, if someone struggles with, I don't know, what does your colleague struggle with, for example, in the workplace on a day-to-day basis?
So one of the things she's struggling with is the feeling of isolation. So because, to be fair, she wasn't a difficult member of staff. She just knew a lot more than many people in the team. So when she did come in, she was put into a bit of a role of a leader where she tried to kind of steer the ship. And that rubbed off wrong on a lot of people within the team. One, because she was new. Two, because they felt insecure around her. They felt their imposter syndrome on spiking every time she was a part of a call because she seemed to have known more than most. And that's led her to this state of isolation. She finds it very difficult to trust people. And the people she does trust, she has this fear that she overwhelms them because she feels as though she smothers them. And that's one of the bits that's kind of struggling with her at the moment, is she's got a friend in me, but she doesn't want to overly give that much time because she feels guilty for me. But then she feels isolated with the rest of the team because everyone else tries to kind of stay away from her a bit. So she's in a bit of a tricky situation at the moment.
Yeah, and I can totally relate to that because you've known me for 20 years now. None of us would have thought throughout our early years that I'd have ADHD, right? And I've had situations where I've completely almost ghosted people, like just gotten off the radar for lengthy periods of time because I just didn't know how to deal with it. And the only person I could talk to was probably yourself and maybe one other person, or even sometimes my therapist. Now, how do you help someone like that? The thing is, because we deal with a lot of internalized shame, it's difficult. And as you said, trust issues, it's difficult to find someone to ask for help, right? But then when I got diagnosed with ADHD and everything started to make sense in my life, it was like a relief, right? So then it made it easy to connect with other people. And so the way to get rid of that shame or stigma is to start opening up to people. For me, that's incredibly hard as it is, but I've had to face my kind of fears because you realize that, look, people are willing to help you. And there are plenty of people like that in the workplace. It won't be all, but there are certainly a few that will. So again, that's why it boils down to having those conversations and raising awareness. And hopefully that's what we're doing in this podcast, because especially coming from, like, both of us come from an Asian background, both of us come from a Muslim background, and there's already so much stigma and ignorance when it comes to mental health, let alone neurodivergence and ADHD. And the thing is, we both know many, many people that have either a child or are themselves have autism or some form of neurodivergence, right? And we've seen the challenge, and people don't like talking about these things. Maybe on another episode, we can talk about why that is. Obviously, it's cultural influence and whatnot, shame and whatever, judgment and all of that stuff. But the only way we can get rid of this or minimize it is to have this conversation. So then the next generation, our kids, like you have a daughter, we can make it easier for them. That's the whole point, is the next generation doesn't have to go through the difficulties of the previous generation or the current generation that's dealing with all these issues.
Definitely. I think it's hard enough being from a BME or from a different ethnic background in the workplace. And then to top it up with that, having ADHD or other mental health, and I wouldn't call them problems or illnesses, just neurodivergent. I think it's bad enough, like the stats came out. Now, I'm not a massive fan of the gender pay gap. I think it's calculated a little bit weird. But the fact that, again, with the gender pay gap, it's identified that Bangladeshi women have the highest gap when it comes to pay. They get 70p for every time a white man gets a pound. Now, add ADHD on top of that. What direction are we going? And these are the things that we need to kind of consider as well. One, ADHD is one. Two is add the ethnicity to it. Three, add your religion. A lot of your protected characteristics you might be able to mask, but you can't hide your ethnicity. You can't hide your skin tone. You can't hide where you were born. You can't hide your socio-economical background, where your parents were, what your parents did when you were born. You can't choose that. And that's why I think when it comes to diversity is not a choice. Hence, inclusion shouldn't be a choice, right? And this is the bit that we need to really start to kind of tackle. It's not as simple as dealing with one thing or the other. Now, I'm not saying I'm a voice for all Bangladeshi men, nor am I saying I'm the voice for all Muslim people, but it's the sum of the parts, right? It's the sum of the perceptions that go into certain themes that highlight insight. And we need to find a way, whether it's bringing more people onto the school, maybe it's creating more of a community, but a way that we don't just support ourselves, but we embrace the fact, like we said earlier, when it comes to emotional intelligence, emotional support, is that shouldn't be a choice either. Being kind shouldn't be a choice. Providing emotional support shouldn't be a choice. It should be an ecosystem, not a transaction. And this is where I think podcasts like this can be really, really supportive, I think, in the workplace and outside. Because if you've got a really good home life, I've always seen positiveness in the workplace. We don't want it to be either or. And this is one thing that I think this podcast can really support with.
Yeah, right. Look at the statistics, right? Percentage of people aged 16 years and over who screened positive for ADHD in the past 6 months by ethnicity and sex. Asian is all 8.9%. So the black community, it's 13%, mixed other 7.2, white British is 10.2, white other is 6.7.
Came up as, so out of the total people that were screened, 7.9% tested positive for Asian men and 10.2 for women. What I do find really interesting in this one, though, was white British was the only one where the gender of male was greater than the gender of female.
Yeah. Surprising, right? And the thing is, women go undiagnosed more often than men because it's harder to spot the symptoms, right? Because of...
Do you mean undiagnosed as in they were screened and not, or are you saying that they don't even
get checked, like they don't even know, or no one, like you can't tell they even have ADHD in the first place to get screened, right?
Okay.
So usually boys tend to be a greater chance of having ADHD. 13.13% boys as opposed to 7.5% girls. So 49% had mild, 45% had moderate, 12.8% had severe ADHD. Most people fall under the category of moderate and mild, I guess.
Since 2014, when we look at the workforce race equality standards that was set by the NHS, we found it was significantly higher. The likelihood of somebody white being recruited over the ethnic minority is a lot higher. The chance of you going through a disciplinary is a lot higher. The chance of you going through a disciplinary wrongfully is a lot higher. We've also got the whole concept in the workplace as the angry black woman. Now, a lot of these things, I look at it and ask myself, it can't be that ADHD was the cause of it. If you're in a position in society where there is discrimination in the workplace, no one can hide from that. And this has led and impacted you in behavioral ways that makes you disengaged. Now, is there a chance that through society and treatment of the way you've been treated in society can lead to that? And maybe that's something that we can bring in an expert in one of our future sessions who can come and talk about their experience. And it's a really harsh thing to say, but it's something that's not a secret in the workplace. Yeah. And it's surprising that when it comes to the stats that you had, the highest percentage was in black women.
Yeah, and it's hard being a woman in the workforce as it is. Race and ADHD, how people of color get left behind. So this seems very interesting. So when she was finally diagnosed with ADHD, no, I don't want to read all of it. Janelle, 36, is an African American and she grapples with an uncomfortable truth. The face of ADHD in the US is not black or brown, it is white, both in terms of the patients being diagnosed and the clinicians evaluating and treating them. Battling ADHD stigma in the BIPOC community is nothing new, but evidence shows that people of color, Black and Latino in particular, are much less likely to be diagnosed with ADHD. Even though they show symptoms as at the same rate as white people, if they are diagnosed, they aren't as likely to receive treatment, even though many studies show that it can dramatically help kids and adults manage symptoms. So ADHD is not a privileged disability, said Paul Morgan, PhD, professor of education and director of the Center for Educational Disparities Research at Pennsylvania State University. We don't want a situation where ADHD is a condition for wealthy white families. We want to be helping children who have disabilities regardless of their race or ethnicity. But what we're finding is consistent evidence that white and English-speaking children are more likely to be identified, and that's an inequity. We can read all of this another time and probably discuss. But the thing is, ADHD medication is extremely expensive. In the UK, you can go through either the NHS or private providers such as ADHD 360, the one that I use. Now, the issue is you can also have a thing called, I forgot the name of it, with the NHS, the referral thing.
Which referral thing?
Patient journey, 1 second. It's called Right to Choose. Right to Choose. So with Right to Choose, you can basically get, so normally how it would work is your integrated care board in your area would assign you to a psychiatrist, but you can say, look, I want to have the right to choose and choose a different provider, provided your integrated care board is in contact with them, right? So in my case, that wasn't the case. And the one that they referred me to had a waiting list of 12 months minimum. So I chose to go to the private route. Now, the private route, you're looking at up to almost gold package for this is £655. Platinum is 810. And this is just your, look, medication and assessment is not included. It's just full 12 months of cover for checkups with your clinician, formulation, like a treatment plan, follow-up questions. They provide letters to your GP, letters to your employer. When you factor in the assessment costs, which is another around, it could be around £300-400, then you got to factor in the monthly cost of medication. Now, depending on your dosage and depending on what medication it is, that could be anything between 30 to something between 100, even £200 a month. It's really expensive. Now you're looking at a total cost of around, for the first year at least, over almost, £1,500. After that, you can obviously either move to a shared agreement where the NHS takes care of your prescription in the UK, or if you are assessed and you get your medication and you're stable and you've navigated your titration plan, then you can get on the shared agreement a lot quicker, which would then save you money on your prescriptions and the cost of medication.
So one thing I was going to ask you went down that route, right? Now, I appreciate that when it comes to like socio-economical backgrounds, that the financial bit, there's a bit of disparity when it comes to ethnic backgrounds. But I think mixed in with the fact that a lot of us from religious background, cultural backgrounds, many people don't believe that ADHD is even a thing. Now, how does a child who doesn't have an income convince their parents to get support at an early stage from an ethnic background? And what can we do as a society to support that?
Well, it's not the child's responsibility, is it? It's the responsibility of the parents. These days, I don't know how schools operate, but they usually have like a counselor, or I think teachers are probably trained in identifying symptoms of ADHD. And if that's the case, the school can refer them directly to a psychiatrist, which will then inform their parents, which would then means they can take the right course of action. Because if you can identify it and start treating it at an early age, then you can save a lot of the struggles that person would have gone through had they had not been diagnosed at an early age.
See, that's the madness, though. I don't know, so we haven't been in school since over 20 years ago.
Look, no one, when I was in school, no one would have looked at me and said, this boy has ADHD. First of all, because I was extremely well behaved. Secondly, I didn't show the signs of impulsivity or inattentiveness. I was actually quite a good student. And then thirdly, I wasn't fidgeting or misbehaving. Now what happens is when they see a child misbehaving or they're extremely difficult to deal with, they kind of know that they have ADHD. But what if that child is like me, who's actually quite introverted, quiet, and doesn't misbehave? That's the issue. How do you identify those children?
That's the thing. It's like I look at it and I think, all right, well, fine. It's not the responsibility of the child. Whose responsibility is it? If the parents don't believe it, the child then doesn't. It's not their responsibility. What influence does the school do to check it? Because when we were in school, and I know like it's a lot different now than it was back then, but I thought that I remember when I was a kid. Yeah, I wasn't the best behaved child. I was far from it. But there was a period of time where I went through severe depression when I was in year 7 and year 8. And we had to go through this whole, you know how it is, that whole black magic stuff, putting on the amulets around your neck, writing all this bogus stuff onto a piece of paper. That was the primary solution to my mental health issue at the time, which in fact impacted me more negatively because it led me to being even more disrupted over the next few years to the point that I nearly got kicked out of school. So I didn't get any support from school.
Just to interrupt you, just to let the kind of the listeners know who may not be from a similar background. So it's quite common in Eastern cultures to practice what you call ritualistic spiritual healers or whatever, who practice, how do you put it in terms of layman terms?
Like a witch doctor, isn't it?
A witch doctor, yeah, who uses, unscientific almost like a home remedy type thing to treat mental health disorders or whatever, right? That's just some context.
So when when I was at school, I had a mental health issue. Now, I don't know what it was, and still to today, I still don't know what it was. But what happened, I came from holiday, everything changed. I was in a really, really depressed state for maybe around 6 to 8 months, and it got really, really bad. Parents didn't know what to do. Instead of going to the GP, what did we do? We went to the witch doctor back in America. They made me wear an amulet. Now, in that time, the school could physically see that, something, there was a difference in my character. They can see there was a difference in my behavior. And they didn't do nothing. They didn't go and they didn't check. They didn't ask if everything's okay. They didn't reach out to my family. The only time they reached out to my family was to either collect me from school or to come into the school to end my suspension. There was no support or kind of asking, well, what's going on? Now, I don't know how schools are now. Maybe one day we can bring a teacher on to say, well, how are teachers trained? But the state of the school system, it doesn't look like it's any better than the state of the healthcare system. So again, where do we go?
I mean, during that time, I don't think many people even knew what ADHD was. Only it was like a very select few. But now, because there's research, there's books, it's become a lot more mainstream. And this is part due to people like Gabor Mate and authors like psychiatrists, psychologists like that, writing blogs, etc. And people also writing blogs and as such. But it's become a lot more, I guess, easier to identify. And I think maybe this is the thing. I think we could talk to a teacher or maybe bring on a specialist to discuss this, to get insight on how you identify the symptoms of ADHD at an early age. For kids, I think they need to have on the ASRS screening tool 6 symptoms from each category. So I think a total of, is it 6? I need to check this. But yeah.
Okay. What do you think is the next best thing that we can do with this?
So, I mean, my direction for this podcast is to bring on different guests, whether that's professionals in the industry, normal people, make it so that we create awareness, because we both come from an Asian background, Muslim background, and people from our background do not like to talk about these things, let alone, mental health and ADHD, because there's a lot of shame and stigma. So the best thing we can do is to break that stigma by talking about it, because I'm sure listeners will listen and be able to relate to our own struggles. You as a neurotypical person having to deal with someone with ADHD or neurodivergence as a manager or in the workforce or even, in your family perhaps. And me as a neurodivergent who's had to deal with a lot of these things that, now I know could have been prevented had I, been diagnosed at an early age. But that's the challenge, isn't it? That's our job, is to make people aware. And this is why we started this podcast.
Sounds good.
And I think on that note, I think we can wrap up. I think it's been an interesting discussion on ADHD. We started off with ADHD in the workplace and the struggles people from, different backgrounds have. We looked at some statistics. Surprising one was that if you're from an ethnic background, women are more likely to be diagnosed with ADHD than, if you're from a white background. We will look at the next topic. I'm not sure what yet, but we'll decide that in the next few upcoming weeks. And yeah, we'll carry on the conversation. So I hope you've enjoyed it, Sam, because I have.
Yeah, no, definitely. It's been insightful, man.
Definitely for myself. So This is our first attempt, by the way. So, bear with us as we get our bearings right with the platform and, how to do a podcast, if there's even such a thing. But really appreciate everyone listening in. This is the Asian DHD podcast. My guest was Sam today, a health worker from the UK, and he also happens to be one of my close friends. And I think we'll end it there.